Good afternoon. Have you ever had trouble falling asleep or staying asleep? Is the lack of sleep affecting your mood or your stress levels throughout the day? Maybe even your health? Well, let me tell you, insomnia is defined by Stanford Healthcare as a common sleep issue that presents itself when one issue is falling asleep or staying asleep. When discussing the duration of the illness, there is transient insomnia, short-term insomnia, and chronic insomnia. In addition, there is a primary insomnia, secondary insomnia, along with insomnia, sleep maintenance insomnia, mixed insomnia, and paradoxical insomnia. Insomnia can be diagnosed through an array of health exams. Some treatments of insomnia may include cognitive behavioral therapy and prescription sleep medication. Relating topic to the audience. I'm sure not most of you in this room have experienced a form of insomnia at one point in their life. If you've experienced any trouble sleeping or think you are suffering from the symptom of insomnia, please see a healthcare physician to see if you are suffering from insomnia. I remember going through periods in my life where I was having a lot of trouble sleeping, whether it was falling asleep or staying asleep. It it is good. It's a it goes to a point where it's affecting my day to day life and my physical mental health. It turns out I was suffering from insomnia. During the remainder of this discussion, I'm going to address various types of insomnia, how it affects people's lives, and the different treatments of medications that are used to treat this sleep disorder. Transition to first main point. To begin the presentation, I would first like to address different types of insomnia and how to identify them. Okay, not many people know that there are certain types of insomnia. For instance, depending on of duration, and certain types of insomnia. For instance, depending on the duration, there is transient insomnia, which means it lasts less than a month. Short-term insomnia, which lasts between 1 and 6 months, or chronic insomnia, which lasts beyond 6 months. Well, in addition to that, the WebMD clarifies that various types of insomnia that listed depending on other conditions. Primary insomnia means that insomnia is not caused by any other natural health conditions, and secondary insomnia means that it is caused by other conditions such as asthma, heartburn, depression, anxiety, and more. Sleep onset insomnia means that a person having trouble falling asleep, sleep maintenance insomnia means the person has trouble staying asleep, or mixed insomnia means the person has trouble with both falling asleep and staying asleep. Finally, paradoxical insomnia means one undetermined determines that the time they are sleeping. Okay, after exposing the different types of insomnia, let's now look at the different effects it can have on one's mental and physical state. Insomnia can have major effects on one's health, whether it's physical or mental. Insomnia can be considered a major symptom for a different type of mental illness. Insomnia can also increase levels of stress and anxiety. According to authors Fernandez Mendoza, and who conducted a study on how insomnia affects physical and mental health, it is stated that when one suffers from insomnia, they may face cognitive, emotional, hyper rational, such as feeling obsessive or anxious. Insomnia can cause physical toll by any on your body and you how you do things on everyday life. As explained in the study previously mentioned, diseases such as cardiovascular heart disease, type 2 diabetes, and can be attributed to these types of factors, which are all symptoms of insomnia. It could even be linked to weight gain or depression. There are various ways that one can be diagnosed with insomnia, and there are many treatments one can take to treat a sleeping disorder, such as medications or relaxation techniques. According to the Mayo Clinic, on the diagnosis and treatments of insomnia, one can be diagnosed with insomnia through a physical exam, which doctors may be able to track why the patient is having trouble sleeping through the blood work. Sleep habits review, where doctors conduct analysis through a series of sleep. Okay, the Mayo Clinic also shares treatments such as cognitive behavioral therapy, prescription medication. Some cognitive behavioral therapy includes stimulus control, therapy, relaxation techniques, sleep restoration, and sleep therapy, which are all indeed intended to promote good sleep habits and better health sleep. Doctors may also prescribe sleep medication to patients suffering from insomnia. In conclusion, insomnia is a common sleep issue that presents itself when one has issues falling asleep. When discussing the duration of the illness, there is transient insomnia, short-term insomnia, and chronic insomnia. In addition, there are many types of insomnia. It is important to note that insomnia can take a negative toll on the physical mental health and must be treated immediately by a physician. With that being said, thank you very much. Goodbye.